In the interest of full disclosure, I'm a co-sponsor of the Patient Safety Act, so I support it. I hope it passes. And if it doesn't pass here, I hope it passes on the ballot. But we have heard, considered testimony on the other side, and I want to be respectful of that testimony and respectful of everyone's opinion. But we heard from the other side that the California law hasn't worked, and I've heard something quite different from you. And perhaps you can elaborate a little bit on that.
We use data from the American Hospital Association Annual Survey of Hospitals that reports the number of RN full-time equivalent hours. And we looked at it over a decade, and we trended those hours and admissions and ED visits comparing California to Massachusetts. And while the two states were no different in 2000, by 2011, there was a marked, significant gap between California and Massachusetts. Our staffing remained completely flat over the decade, and their staffing rose significantly, the number of nurses that were available to take care of patients. At the same time, the demands on the nurses, especially in Massachusetts, significantly rose. Those demands didn't increase in California. So at the same time our staffing for nurses is staying flat, the demand for care of patients is significantly increasing, which adds about an hour and a half more time every time a patient is admitted, discharged, or transferred to a bed. So that I can't emphasize enough. This is the gold standard of research, where you have a baseline data, then there's an intervention, and then you measure it, and you don't measure it 1 year or 6 months, but we measured it from 2000 all the way to 2011. And that shows them we are falling behind. We have fallen behind. That's what our data proved. And we also did a study. I heard somebody comment on heart failure readmission and all the factors that go into heart failure readmission. It's an important outcome to look at because it is going to cost billions of dollars. It costs billions of dollars a year, and it's going to cost Massachusetts hospitals millions of dollars. And we tried to explain the variance because California, I don't know where the previous speaker got that information, but California has lower readmissions than Massachusetts. So we tried to explain that. And we were able to explain a significant amount of the variation. And it has to do with staffing. So we are looking at, in a very systematic way, how that bill in California to mandate RN to patient ratios has impacted the staffing, what's happened in Massachusetts during the same period of time, and we are finding that there is a marked difference. We're falling behind, and our patient outcomes are suffering. Then we also went and we looked at the Patients First website because, as journalists from the Boston Globe said, only a data geek can interpret that. Well, we interpreted it. We did the ratios for every single Massachusetts hospital, every single unit from 2009 to 2011. It took nursing students over 4 years, 5 years to do that. And you have that data in front of you. I provided it to you. You can see where the outlier hospitals are. You can see that one of the hospitals with the worst staffing in the state has got a profit margin in the double digits. You can see that we couldn't find any correlation at all between acuity and staffing on step-down, med-surg, intensive care units for adults or newborns. The only place we found a correlation was with the emergency department staffing. So I believe in transparency. I've given you the information now. You can see which hospitals we're talking about are going to be impacted here, to how much of a degree. And it's over a 5-year period of time. So you can't get more rigorous analysis than that.